Hi, welcome to Gilda's Club Kansas City and our intro to acupuncture class. I'm Clara Saint, our program director, and with us today is Jennifer Kong and Holly Battrum, who are with Elements, and they will walk us through our slideshow today. And thank you for your patience as we figure out this technology. And again, at the end of the recording, we'll stop it for question and answers. So go ahead, Holly, Jennifer, who's ever up.
I think it's me.
And just yell at me if I haven't clicked through fast enough.
Okay. All right, so we'll start off from the very beginning, about over 3,000 years ago. Traditional Chinese medicine has been practiced and grown for well over that long. It dates back to the Shang Dynasty, which I did the calculations, is actually about 3,600 years ago. And during that time, they had found hieroglyphs of acupuncture and Moxibustion that were found on bones and tortoise shells. Oh, hold on, wait.
I know, I don't know how I did that. Okay, we're good. I'm sorry.
Well, unless you want to move on. And then during the Warring States period, between that time and the Han Dynasty, is when there was really a flourishing and refinement of Chinese medicine. So the medical texts were compiled, and by text, it was probably more like scratching characters onto bamboo slats. And then also the needles were also had evolved. So they went from like sharp stones, which they called bien stones, and then they evolved into bronze medical needles, and then onto the metal medical needles. Not quite what we're using today, but well more refined than the stones. Okay. And the next slide, talking about the prevalence of Eastern medicine. So worldwide, the prevalence of traditional medicine is about 65 to 80%, and that's treating all various different kinds of conditions. And then within America's top cancer hospitals, about 8 out of 10 of them have acupuncture specialists on staff. So it's becoming quite common as a part of some integrated hospitals.
So when we go from the Shang Dynasty to the US, we really made a number of years of jumps there. Outside and starting to become in the popular culture, of course, many homes and families were using different types of traditional medicine before that. But we started to see it becoming a little bit more popular in the 70s in the US. If you go to pretty much any website, you'll kind of see this story about President Nixon becoming the reason, with an experience of a chip in China, that the reason it became popular. But it was actually used, since we talk about it in integrative medicine and mass institutional use, it was used in the People's Drug Program in the beginning of the 1970s at the Lincoln Detox Center, which I think is really interesting because it's kind of been set aside as to have this one particular story of how it developed, when really this is another story that we know about, and really the first incorporated acupuncture treatment in the US versus private practice or private houses. So I think that's interesting, and how we got to where we are today a little bit closer. And it seems like a relatively new medicine in the US when we talk about 1970s, but if you talk about another form of palliative care, that's actually really commonly used medicine now, and it's even younger than this. So the cool thing about that is it means we have a lot more places to grow and develop, and we can take that history and kind of transition it into our new development. Next slide, please. So we commonly talk about Eastern medicine and acupuncture and traditional medicine. We kind of throw those around, and oftentimes people think about acupuncture and that's it, which we do spend most of our time talking about that. But Eastern medicine itself also includes Moxibustion, Eastern herbal scripts, cupping, Gua Sha, and Qigong. And so we're going to kind of walk through those as well so that people have a broader understanding of that. Jennifer, you can take back over.
All right, crumple that piece of paper up. All right, for acupuncture. So the definition of acupuncture is insertion of thin filiform needles into strategic anatomical points located throughout the body. And as we inform all of our patients, the needles are all single use only. They're FDA regulated and they're all in sterilized packets. And it should be administered by a qualified practitioner. And despite what a lot of people think, there's no substances injected or removed from the needles. It's just the needles that are doing the stimulation themselves. Another adjunct therapy that goes with acupuncture sometimes, and this is kind of more of a modern adaptation for it, but the electroacupuncture is something that we sometimes will use. So this is the use of micro or millicurrent attached to the acupuncture needle. I don't know if I'm on or not, but this is kind of the one that we have, this ginormous one that we have at the office. And so we have little gator clips that will clip onto the needles, and then we'll run a little current between the needles. And this basically just helps to increase the stimulation of the needles, so we don't have to do manual manipulation the entire time. But we typically have seen this good for pain primarily, so we'll kind of use that in addition for sometimes maybe for swelling and some other indications. But it's a good thing to have in addition to the acupuncture for certain people. And if we could move to the next slide, please, we'll talk about, oh, here, I was going to show, it's not too late. My video's not on, so I can't really see it. This is.
Yeah,
You're good. Yeah.
But that's kind of what a pack of needles is. So there's actually 10 in there. So there's a guide tube, and then you can kind of see how thin the needles actually are. All right, so Moxibustion is the act of heating the herb called mugwort. And this is done near the skin or over specific points or areas of the body. And this is kind of what a moxa stick looks like that will hold over a point. So it does get a little bit smoky, like you can tell in the photo. But the Moxibustion helps to improve circulation of body fluids, lymph, blood, and oxygen. And what we commonly will use it for, things like pain, arthritis, gynecological disorders, any type of abnormal bleeding, like minor abnormal bleeding, and then also diarrhea. So it's a really great thing that we will incorporate if people tend to have like weaker constitutions or colder constitutions. But it's also really great for supporting the immune system too. All right, and next slide, please. Move on to the herbal prescriptions. So the Chinese materia medica is made up of thousands of medicinal substances, and these can range anything from plants to seeds to minerals and even some animal products. I do like to clarify that in our office we do not have any species that are endangered or remotely close to being endangered. Most of our things, we're very limited in what we carry in terms of like animal products, but most of them are going to be like oyster shells or like sometimes there are little bugs that we don't necessarily want to advertise, but you know, like potato shells, there's some certain ones that do have really great benefit. And there's various ways that we can prescribe them. There's we don't have the raw herb decoctions in our office because we find that it's a little bit harder for patients to be compliant. They have to boil the raw herbs for a couple of hours. So what we have in our clinic is going to be granules, and that we combine into custom formulas for people. We also have a couple liquid extracts, and then also capsules, tablets, and tea pills. Typically, the granules are going to be, out of what we have here at the clinic, the granules are going to be the most potent. The raw herbs are obviously going to be the best in terms of potency, but for compliancy's sake, the granules have more effectiveness than the liquid extracts and the capsules and tablets will be, and they're also tend to be less expensive as well. And I also just want to emphasize that when you know, when we're doing these herbal formulas and prescriptions, these are going to be a combination of different herbs that help to balance each other out. And also we have certain herbs that help with toxicity and that help to kind of checks and balance the whole formula. Whereas sometimes, you know, if you see single herbs used alone in high dosages, that's usually when you start getting issues with any inhibitory effects with medication, or sometimes, you know, some interactions. And that's why I just like to caution people, like if you're buying the single herbs, you know, like at the box stores, you know, just use it with caution, because that's not typically how, or traditionally how, the herbs are prescribed. But we will typically, like, here's an example of some single herbs that we will combine into a formula and, you know, label it for each patient. So, you know, all you do is add hot water and mix it up into a tea and kind of drink that a couple times a day. So that's kind of what we do here at the clinic. And then Holly will talk to you about cupping.
So cupping, obviously, you probably have seen it at this point. You see those little round marks. Michael Phelps made it popular a few years ago at the Olympics. But it sounds scary and looks scary, but it's not at all. It actually feels fantastic. And you basically are using specialized cups to suction to the skin, and they can be glass, they can be plastic, they can be silicone. That's really going to be practitioner and office preference wise. You know, sometimes the silicone will fit in different areas. We love to use the glass at our office, which you know, gives us a little street cred because we're still using the traditional fire cupping component of it. So these are going to be things that you use to increase blood circulation to area, loosen the muscles, separate the fascia, promote lymphatic drainage, that kind of thing. Oftentimes, sometimes we'll do them without a needle treatment. Oftentimes they're used to complement the acupuncture and kind of give it a little bit more of a global treatment. And the acupuncture is very particular and specific, personalized treatment in a lot of senses. The other technique that we mentioned is Gua Sha, which is very, very similar to cupping. Once again, you may have seen this kind of run around the internet in a lot of senses. It's another one of those that looks a little dramatic. Gua literally means to scrape or to rub, and then Sha is the red color that you get when you rub your skin. This is going to be done with this particular tool and an oil, and once again, it improves blood circulation to the surfaces of the area, and it kind of stimulates this anti-inflammatory and immune response. It feels great, particularly like neck and shoulders and that kind of thing. So it's often used for pain, but also can be used for colds and flus, that kind of stuff. It's sometimes been called coining, just depends on what culture you're kind of bringing it from. But in our particular area, we're calling it Gua Sha. So next slide. Qigong is another arm of the traditional medicine component that we work with. She just did a great practice this morning with a colleague, now on Zoom, of course. But Qigong really just means breath work. It can be any sort of mindfulness practice. So sometimes I think Gilda's offers some Tai Chi classes. So this is also that would also fit under the Qigong component. It's breath work, it's physical postures, it's slight movements. And it's pretty cool because it's actually been researched to have positive effects on cancer, particularly quality of life and fatigue and immune function and cortisol levels. So one of the practices that we were doing this morning was, you know, activating testosterone and calming cortisol, so to kind of make the body function a little bit better. So, and the nice thing about Qigong is that it's not such an active workout that you can do it if you're already feeling tired. It can help support the system without making you feel like you have to go run around the block.
All right, so Eastern medicine and co-treatment of cancer. So these are some common symptoms that people might have complaints about during their cancer treatment that we can help address. So the nausea, vomiting, fatigue, and then also with the appetite, low appetite particularly, chills as well as hot flashes, and peripheral neuropathy. Pain obviously is a common one, and a lot of anxiety and depression and quality of life, like anything that's going on, mentally is also benefited by the acupuncture. Shortness of breath or xerostomia, the dry mouth, and edema are some other symptoms too that we can help to treat. And on the next slide, we'll continuing on with more benefits of Eastern medicine during cancer treatment. So it's more kind of like listing this off, but again, reducing nausea, vomiting, it can help to increase the energy, and it can balance out to the appetite if you happen to have an increase of appetite, usually from the steroids. Reduces hot flashes and chills. It can also increase quality of sleep and improve the anxiety and depression, and again, helps with dry mouth. And if you tend to have any rashes or itching or any drug side effects, the acupuncture can kind of help calm that down a bit too. The Eastern medicine can help with aiding in healing of sores and also harmonizing immune function, whether or not you need it to be balanced out a little bit, whether it's too high or too low. And we can also help to increase red blood cell count and platelet counts and the white blood cell counts as well, especially the neutrophils. And some additional benefits. I know the list is long, but we can help to regulate blood pressure and also improve circulation. The Eastern medicine also helps with peristalsis of the esophagus, so helping kind of move any constriction along with the throat. And we can also help regulate stomach acid secretion and protect the stomach lining. And with urination, we can help to promote it, or we can help to reduce it depending on what issues you're having with it. And pain obviously is a big one. And then stabilizing peripheral nerve damage. We can also help promote relaxation, which is a huge one, and improving mental alertness for, the chemo brain, and also decrease swelling and edema. And we can help with improving intestinal motility, typically the constipation that's common with some of the pain meds. And, in terms of operations, we can help shorten recovery time and increase the incisional healing.
So oftentimes the question that we get is, does it work, or how does it work? And so there's a ton of different things that we obviously don't know yet, but we do know a lot from the research that we've done, even in the Western research on the Eastern medicine. But one of the things that we know is that we're activating fibroblasts and fascia. So the fibroblasts are kind of the decreased inflammation. They're the little cells that have to come into the cellular matrix when you have an injury to help the circulation of the lymphatic flow and stuff like that. So we know that we're increasing those fibroblasts, therefore decreasing inflammation, which once it becomes chronic, we don't really want it to be there. So another way that we know that it works on a biomolecular level, on the next slide, is that we're working with the body's own endorphins. So basically, we're creating our own morphine with the endorphins. So we're stimulating the body to release its own natural killer cells, and therefore also helping heal the tissue and the disease resolution by using the ATP and the adenosine. So you need your ATP to help your body function. Sorry, just lost my batteries there. How better now? Next slide. Talking about nerves. So oftentimes you'll see these channels that we talk a lot about. We even have a couple of AccuDolls in our office that demonstrate where the acupuncture points are. So what we're doing is we're picking these acupuncture points based on a bunch of information that we've been given by you. And we're creating these patterns with the points. And these points are all going to be on the channels that are on the surface that then they go into to communicate with the body. So they're not, the channels are not nerves themselves, but we do know that the acupuncture is stimulating that to create a communication with the nervous system. So once we insert the acupuncture needles, we're sending these messages to the peripheral nerves that then causes the brain to remember how to heal the body. So we're able to take that message and help the body use its own resources to heal, which is why we can not have anything on the needles, but still allow for the body to basically get out of its own way so that it can remember what it's supposed to be functioning as. Jennifer, you're up.
So through these different systems, we can see how the acupuncture helps. With the central nervous system, it can help switch a person out of that fight or flight mode. So, you know, having, being, you know, having that stress mode, and it actually can help regulate between like the sympathetic and the parasympathetic systems. And through the nervous system, it can also help reduce pain, kind of what Holly was describing earlier. And with the endocrine and digestive system, we can increase appetite. And then through the circulatory and skeletal system, we can help increase blood flow. And with the endocrine system, we can help to increase salivation and help promote those glands, to kind of stimulate the glands to help promote the salivation. And we can also improve immune function and swelling through the lymphatic and circulatory systems. And with the nervous and endocrine system, we can improve mood and sense of well-being as well as sleep. And again, with the circulatory and lymphatic system, we can help with that, the post-surgical issues with healing and reducing scarring. And then acupuncture can also help with increasing the vagal nerve tenacity. All right, so kind of what will happen here at the office on your first visit is that we'll go through your main concerns, and we'll look at your goals, and then also go through and do complete health history. And then also take into account your questions and also any issues with bleeding or low platelets. And we'll address those concerns and kind of simulate everything into a healthcare plan for you, and kind of give you an idea of, you know, how many visits it might take or how frequent you should come in, and really make sure you understand kind of what we're going for, and making sure your needs and your goals are met. Okay, next slide. And there's some recommended treatment schedules. This is based off of Memorial Sloan Kettering's suggestions. But for people undergoing chemotherapy, the acupuncture can help with improving the immune system during that time, and then also alleviating toxic effects of chemotherapy. So ideally, this is done 1 to 2 days ahead of each schedule. Of each cycle. And then also you could also incorporate the acupuncture 24 hours before and after treatment if needed. And then on the off weeks, you could get more acupuncture or also massage to kind of help with those symptoms and kind of getting you through the whole process. For radiation, it's recommended to do acupuncture 1 to 2 times a week, and then ongoing through the duration of the radiation treatments. And then for pre-bone marrow transplant, you could do it ideally during the preparatory stage, pre-preparatory stages, which is a few weeks before your actual transplant.
So I don't know that we've talked a whole lot about this quite yet, but we talk often in Chinese medicine in particular that a lot of these protocols or outlines are really bio-individual. So one of the things that we would say is, though there are plans that we work with, oftentimes we are picking out the best suited plan for you and your constitution. However, that is also guided by much research. And so I love this particular, it's updated frequently. You often hear people say that there isn't really any research in East acupuncture, Chinese medicine, and acupuncture alone, as of January 2020, had 13,000 trials on it. So pretty much the only medicine that's more researched than acupuncture is nursing care, like 21,000 studies. And that's just acupuncture. So there's plenty of research on the herbs and the cupping and that kind of stuff. So I always like to bring that up a little bit just so that you're aware that we're not just pulling from 36,000 years of history, or 3,600 years of history. We also have some modernized research, and we're combining that to get the best of both worlds. Next slide. Another thing is that we do have those lists of all those benefits that Jennifer went through. In 2015, we found over 870 recommendations for acupuncture alone for over 100 conditions. I know that even our business managers like, could you narrow it down a bit? But basically, because we're able to really use the body's own resources to help people heal, there are many things that can be helped. So it's always worth asking, putting in a call to your, provider that's closest to you or you've been recommended to find out if something that you're dealing with might actually be helped with this. The other thing that I think is great is the American Specialty Health Incorporated Services did a study to make sure that they wanted to keep paying for it for health insurance, and it was a study of over 89,000 patients, and 93 of those people said that their provider was successful in treating their primary condition, which is a pretty high percentage for any medicine. Earlier in the lecture, Jennifer mentioned having a qualified professional. Just because there's so many different ways sometimes that things can be licensed or provided, we like to just mention that ideally, especially when you're dealing with something such as oncology, you want to go to a provider that has a strong awareness of what you are going through so that you can get the best care. So in order to be a licensed acupuncturist, you have to have a minimum of a master's program, which is over 3 to 4 years long, with 3,500 hours of education. And then we have our generalized programs. And then most of us end up doing subspecialties along the way, just because there's so much information out there. You do have to have 4 national medical boards that you have to pass in order to, 3 if you're just doing acupuncture, 4 if you're doing herbs as well. And then most states require a state licensure. And then of course, on top of that, you can do your doctoral program as well, which is not necessarily required for license, but it allows for more training and more specialization. And that is what we have to share for today. So it sounds like we can open up for questions and let us know. Hopefully you can hear us.
Okay, hold on.